Hi, I'm Laurel Wood.
And I'm Kayla Patel.
This is our Phobic Disorders project.
We chose this topic because we wanted to better understand the types of phobic disorders and understand how we get them, as well as trying to resolve them.
We hope you enjoy the presentation.
There are 5 types of phobic disorders. Situational, which depends on the situation. For example, being on airplanes, being in enclosed spaces, or going to school. Natural environment, such as thunderstorms and heights. Animals or insects, such as dogs or spiders. Blood-related phobias, such as injections or injuries. And other types of phobias, such as choking, vomiting, loud noises, and clowns.
Physical symptoms of a panic attack induced by a phobia may include sweating, trembling, difficulty breathing, nausea, headaches, numbness, confusion or disorientation, a pins and needles feeling, chest pains, or tachycardia. Tachycardia is a condition that makes your heart beat more than 100 times per minute out of proportion to age and activity level. Not all people with a phobic disorder may experience all of these symptoms at once. They can occur in different combinations at different times.
There are 4 different psychological symptoms: fear of losing control, fear of fainting, fear of dying, and feelings of dread.
Some of the most common phobias include claustrophobia, acrophobia, zoophobia, bathophobia, aerophobia, aquaphobia, astrophobia, and hemophobia.
Claustrophobia, the fear of being in a small or crowded space with no means of escape. For example, an elevator.
Acrophobia is an extreme or irrational fear of heights. This could be on a mountain, a tall building, or other high spaces.
Bathophobia, which is a fear of depths. This may include the ocean, tunnels, caves, and valleys.
Zoophobia is a fear of animals beyond what is normal and natural, such as a fear of venomous snakes or bears. This phobia includes arachnophobia, an irrational fear of spiders, ornithophobia, a fear of birds, apophobia, a fear of bees, and other phobias relating to harmless creatures.
Aerophobia is a fear of flying in an airplane or related vehicle.
Aquaphobia is a general irrational fear of water. This can include bodies as large as the ocean and as small as the water in a bathtub.
Astrophobia is the fear of thunder and lightning. This phobia is possible in humans and in animals.
Hemophobia is an irrational fear of blood. It could be triggered by witnessing an injection or a wound. Severe cases of hemophobia may include fainting as a symptom. This response is uncommon in sufferers of other phobias.
There are several causes of phobic disorders. Specific phobias can develop during childhood. A specific phobia is any kind of anxiety disorder that amounts to an unreasonable or irrational fear related to exposure to a specific object or situation. Negative childhood experiences can influence phobias, and some phobias can be learnt through observation. For example, if your parent had a fear of heights, you might grow to have the same fear. The cause of complex phobias is completely unknown. People believe that genetics, brain chemistry, and life experiences may play a role in complex phobias. It is possible to condition a phobia during early childhood, as John B. Watson demonstrated with the Little Albert experiment.
In the Little Albert experiment, behaviorist psychologist John B. Watson proved that it was possible to condition a phobia in an emotionally stable young child. By causing 9-month-old little Albert to associate unpleasant loud noises with white rats, John B. Watson caused him to develop a specific type of zoophobia. Little Albert also developed a fear of other fuzzy animals, such as rabbits. In this case, little Albert's phobia was a conditioned emotional response to stimuli. The causes of other specific phobias may not be as immediately clear.
As mentioned in the previous slide, John B. Watson conditioned a phobia in an emotionally stable young child. In the picture before you, little Albert is screaming and crying out of fear, which would now be his conditioned response to seeing fuzzy animals.
The day-to-day life of someone with a phobic disorder may vary according to the type of disorder and its severity. Robin Wilder, a staff writer for BuzzFeed, lives with agoraphobia, a fear of places and situations that might cause panic, helplessness, or embarrassment. This is an example of a complex phobia, unlike some of the simple phobias we've discussed earlier. She developed this phobia after college and is cared for by her parents. Because she has difficulty eating during the daytime due to symptoms of her phobic disorder, she eats a single, calorically dense meal at 2 a.m. She leaves the house around 10 a.m. It takes her a while to work up the courage to leave. At the recommendation of her therapist, Wilder has begun a gradual process of desensitization, in which she travels to increasingly distant places to reaccustom herself to them. This may include walking to the bus stop, riding on public transport, or going to the mall, as she describes in her article. After a trip to the mall, she returns home, reads, and practices piano. She walks her spaniel in the woods around 3 p.m. to relax before kids get out of school. She meets with a psychologist once a week and calls her friends in the evening before going to bed around 8 to 9 p.m. She sets an alarm for 2 a.m. to prepare for her morning meal.
Phobic disorders are so prominent in our world today. Phobias are the most common mental disorders in the U.S., according to the National Institute of Mental Health. 9.1% of the U.S. population has specific phobias. That's more than 19 million people. 7.1% of people in the U.S. experience social phobias, and 0.9% have agoraphobia, which is the fear of certain places or situations. Percentages are low because phobic disorders are underreported and people don't talk about them. Specific phobias start to appear in children at the age of 7. Specific phobias in teenagers are more prevalent than in children, occurring at a rate of 15.1%. More than twice as many women as men have specific phobias.
Phobic disorders have been recognized in different forms throughout history. Hippocrates described instances of specific phobias in ancient Greece, while the Roman philosopher Cicero wrote that affliction, worry, and anxiety are called disorders because they represent an imbalance between mind and body. He distinguished between situation-specific anxieties and phobias and generalized anxiety. Seneca and Cicero advocated Stoicism as a cure for anxiety, and some therapists promote Stoic values as a solution today. The concept of anxiety and phobias as an illness disappeared between the collapse of ancient Rome and the advent of modern medicine. In the 18th century, panic attacks and phobic disorders were seen as symptoms of other disorders, such as melancholia, rather than a separate illness. Phobic disorders were officially classified as a type of anxiety disorder in the DSM-3.
There are several therapies for phobic disorders. Psychotherapy is the most common. Exposure therapy focuses on changing the response to an object or situation that causes fear or anxiety. This type of therapy focuses on a gradual, repeated exposure to the fear, which helps manage and, in some cases, overcome that certain fear or anxiety. Another type of therapy is cognitive behavioral therapy. This involves exposure combined with other techniques to learn ways to view and cope with the feared object or situation differently.
Some medications can help those suffering from phobic disorders cope with their symptoms. Beta blockers work to block the stimulating effects of adrenaline, which is pumped into the body during a panic attack. These may include increased heart rate, elevated blood pressure, pounding heart, and shaking voice and limbs, and are triggered by the fear or anxiety that comes with a phobic panic attack. Sedatives can help relax someone by reducing the amount of anxiety they feel. However, they can be addictive, so they are used with caution.
We hope you learned something new about phobic disorders today.
Thanks for watching.